It's the 21st century disease that's laying waste to lives and health across the globe. A silent killer. Heart disease and stroke needlessly kill 17 million people every year, more than any other disease. It's not a rich world problem. The vast majority of heart disease and stroke deaths today are in low and middle income countries. We know what needs to be done. We need to create a world where heart-healthy choices become the easy choices. The World Heart Federation is leading the global fight against heart disease and stroke.
The vision of the World Heart Federation is for people all over the world to have longer and healthier lives through the prevention and control of heart disease and stroke. The World Heart Federation has a very clear role in raising awareness of cardiovascular disease as the #1 killer in the world and the #1 killer also in low and middle income countries.
Our mission is to unite our members and lead the global fight against heart disease and stroke with a focus on low and middle income countries. It's everyone's problem, and not enough is being done to own a solution. Growing populations and changing lifestyles are combining to create the next public health crisis. Today, 4 out of 5 deaths from heart disease and stroke are in low and middle income countries. Together, we can put heart disease and stroke at the top of the political agenda.
Cardiovascular disease, heart disease and stroke have become the leading health problem in practically all over the world. The world health is under rapid transition. Every third death is cardiovascular. Most of that is already in the low and middle income countries.
Today, the World Heart Federation has a clear strategy to improve heart health. We need to increase political awareness and focus on the solutions that we know do work. Our key goals are to advocate for a higher priority for heart disease and stroke, to improve care, promote healthy eating and physical activity. We work to improve control of high blood pressure globally, to advance a tobacco-free world, eliminate rheumatic fever and minimize the burden of rheumatic heart disease. We focus our efforts in 4 key areas: awareness raising, advocacy, applied research, and sharing science and building capacity.
Now we have evidence to show that the poor within these countries are increasingly at risk of dying from cardiovascular disease prematurely, partly because of lack of knowledge to prevent, partly because of lack of access to care, and also because of the huge catastrophic health expenditure that often pushes them into deeper poverty once they have a heart attack or a stroke.
Every year, more than 17 million people die of heart disease and stroke. We know that together we can prevent deaths and help people everywhere to lead heart-healthy lives. The World Heart Federation, together towards a better, healthier future.